Hi, everyone. Welcome back to Medical Mondays. If you guys are new here, hi, my name is Dr. Jenny Lay. I'm a family medicine physician, and on Mondays, I would like to get with you guys and just answer all your medical questions, non-medical questions, and everything in between. As a disclaimer, as someone who gives medical information on YouTube and on social media, that this is for educational purposes only, and that this should not replace the need for your own personal healthcare provider. All right, so I will be taking questions now. As the same as last time, you guys can put your questions up on the side, and then I will pull it onto the screen. So no one has questions as of yet, but I did want to talk about something that is really important if you are living in Washington State. And I don't know if you guys have know this as of yet, but in Washington State, let me put this up. So in Washington State right now, I think they are planning on, they're not calling it a tax, but then you have to have long-term care health insurance. There has been a shortage on our funds to take care of the elderly as of right now, and a lot of them are going into nursing home care. And so they want us to pay into this. And if you don't have a long-term care insurance plan, then you have to pay 0.58% of your income. And there is no amount that it can limit to, and they can always change it anytime they want. And so if you are planning on opting out, you need to do it before November 1st of this year. So start looking now. It takes some time to set all that up. So yeah. All right. Let's do this first question here. Adriana, hi. Any advice for the MCAT? The MCAT exam is just like every other standardized test, and the studies have shown that the more you do test questions, the better you do on the exam itself. There's only so many ways that the people writing the exam can test you on a certain topic. And so if you do the test questions, you'll understand how the question's worded, what they're asking for, and then go from there. I want to say that I did like 28 practice tests prior to taking the MCAT. I also took the MCAT twice because I didn't do too hot on the first time around. If you are able to get Anki, I believe that they already have Anki cards. It's a spatial recognition where you're able to study. Do you guys know what that is? Comment in the comment box so I don't have to pull it up. But let me see if I can pull this up for you guys. But basically, it helps you memorize things better. Here, let's just read. Let me share my screen and okay. So Anki it's like a flashcard system, and it helps you learn different things. Like there are some that already have MCAT, or like if you're in med school, they already have certain sets like for the board exams or for cardiology and whatnot. And you go through it and it helps you memorize all the different material. I know it was really, really, really good for board exam studying, but this one doesn't really show you. But it basically helps you with long-term memory, short-term memory into long-term memory. Because the more that you repeat something, the more it's ingrained in your body, in your mind. It's a neuroplasticity kind of thing. Okay. All right. This is a good question. Do you have any advice on planning for residencies as entering medical student? I think there's two parts to this question, like residencies as in what kind of specialty you want to go into, or residency as in like how to prepare yourself to be like a good candidate for a residency. I guess the first 2 years of medical school, you learn the exact same things as everybody else. So you do your basic sciences in the first 6 months or so, and then you go on to do all your core competencies like cardiology, pulmonology, gastroenterology, renal, and all that stuff. And then you take your board exam. After, in your 3rd and 4th year, is when you do clinical rotations. And that's when you start knowing what you really want to do. There's people who are obviously like interested in things once they start med school. Like I know people who go in knowing that they want to be a cardiologist, or go in knowing that they want to be an OBGYN or emergency medicine doctor. For me, I didn't know as much because I didn't work as a scribe. I shadowed a physician, but I wasn't exposed more to medicine. My family was all in tech and computer engineers and stuff like that. And so I really had to explore my different rotations before I realized like what it is that I really wanted to do. And so with that, I say just be open on your rotations to see. Most of the time you have to think about, is it the rotation that I love? Is it the topic that interests me? Or is it just the people that I enjoy working with? Because if you work with awesome people, then you're going to be more gravitated towards that job. Like surgery, I had a great group of people. My co-medical students, like they were just awesome. And we would wake up be in the hospital at 5 a.m. and then not leave until like 2 a.m. and then do it all over again the next day. But we had an awesome time because we were together. And so thinking back, I'm like, I would never be able to do that schedule like on my own when I'm in like my 60s. So that's always something that you have to think about. As for students, how do you make a name for yourself, and how are you able to stand out of all the other rotating students there? We as attendings always look for your enthusiasm. If you are excited to learn, we don't expect you to know everything as a med student. Like we expect you to know nothing as a med student, but we also want you to have that ability to read and learn on your own. So say, oh, I don't understand this. Like, where can you direct me to learn more about this? And what's even more impressive is that if you bring it up the next day and be like, oh yeah, I've learned this and da da da. Or if say you take charge, you're rounding with your attendings and be like, I want to pick these 3 patients that I want to be responsible for, and say this person has AKI or something like that, and then you're like, oh, based on this New England journal that I read, should we consider blah, blah, blah. So it's not like outwardly saying like, hey, look at me, I read a lot last night, but it shows that you are taking initiative, you're doing your own studying and reading at home, and you're the type of compassionate colleague that we want to be taken care of by in the future, if that makes sense. So that's really how you stand out. Okay. I hope that answers your question. Let's see. Do you think a 7-year gap between 2nd and 3rd year? I would have to say like there's lots of people who go into medicine and it is their 2nd career, but you really have to explain why there was such a big gap from 2nd to 3rd year. 7 years is a long time. And so a lot of medicine is also changing within those times. So it might mean that you have to repeat some courses. I know one of the students ahead of me had to repeat 2nd year because she had left medicine for a little bit, raised 2 children, and then came back. So they made her retake a couple courses her 2nd year, retake the board exam, I think, and then started clinical rotations. But yeah, it's doable. I mean, life happens. Not surgery, but medical training in general is like almost a decade. And so it's a lot of your life that you're putting on pause. It's understandable that other life stuff happens. Hi, everybody. I am so glad that you're all here today. Let's see. I get this question a lot. Hi, Jessica. That you're on your OB-GYN rotation, you're on L&D, and you want to have tips for medical students to get involved but not feel like they're in the way. Because a lot of the times you're like, I don't know anything, and I really feel like I'm actually a burden. A good resident is supposed to, it's attendings and residents are still learning themselves, and we need to learn how to be better teachers. And that is our experience with medical students, to play that role, to be teachers. I think my best attendings are the ones who said, like, once a week, let's do, or even like if they're really good, they'll be like, okay, once a day, let's sit down and we'll have a learning topic. And this is the one thing that we're going to learn today. And so if they don't bring that up, I think you can take initiative, and you can be like, today, I want to teach you about chorioamnionitis or something like that, or the different stages of labor, or how to read a labor strip. It's a good refresher for the resident, and also they will be able to give you pointers on things that you don't know. As for patient care, I think that things that you need to do on labor delivery is like check in on patients from time to time, but it's hard because you yourself can't check if they're dilated or not. But you can, I don't know what you can do on labor and delivery. It's a lot of waiting until the baby is coming. So check in with the families. If you have a brand new patient, I think it's good to help prep the charts, because there's certain things that you need when a patient comes in, like if they have all the history, if they had any prenatal care, what was their past pregnancies like, did they have GBS, or did they have gestational diabetes or gestational hypertension? What would you do in those instances? And then have they gotten all their labs? So prepping all those things for your resident and presenting that to them may be helpful. So yeah, I know during inpatient, I would like to give my med students 1 or 2 patients that they will be like solely responsible for. They would come up with the progress notes and the assessment and plans, and then they would present it to me, and I would give them feedback and say if I agree with their plan or not. So yeah, I would say always take initiative. Let's see. Mm-hmm. So this was me. Advice for someone who wants to go into medicine but has little to no exposure. So the questions that they will ask you during interviews is, how do you know that medicine is for you? This job is very demanding, both physically and mentally, but at the same time, it could be one of the most rewarding jobs that you can ever have. And so we want you to, we as interviewers want to know, what is the purpose, or like, why do you want to go into medicine? Because a lot of people would feel burnt out or drop out and all that stuff. And so I would say get as much exposure as you can now, volunteer, work as a scribe if you can. I feel like being a scribe is one of the best ways to expose yourself. Not only are you able to experience medicine, you get to learn a lot directly from the doctor. I know a lot of scribes who are in the ED, they get exposed to all different types of trauma and treatments. And then there's all the other subspecialties, like dermatology tends to have a lot of scribes because they see so many patients. Rheumatology, neurology, and lots of other things. So you get to rotate around on just whoever gets to pick a scribe. I personally do not have a scribe because they are expensive, and based on my salary as a part-time physician, it's just not worth it. I would have to actually see 1 or 2 more patients in a half day to pay for the scribe. And that just kind of defeats the purpose for me. Like I loved spending time talking to my patients and getting to know them. I feel like if I had to see more patients, I would just be too stressed out. But yeah. Let's see. Let's see. Oh, you guys have a lot of questions today. Oh, I love it. I love it. Keep them coming. This is a good question. Any advice for students with anxiety on rotations? I think I need to know what you're anxious about. Like, are you anxious about being pimped by the attending? A little bit of anxiety is always good. As I said, we as attendings don't expect you to know everything. And there are obviously some attendings that are more mean than others and try to pimp you. But I would have to say that I apologize on their behalf because that is probably the only way that they were taught going through medical training. So they've been through so much trauma through the medical training process that is the only way that they know how to teach. And so I apologize for them. And please know that it's not because of you. It's just they are traumatized, right? And so if you are anxious, I would just, say that up front in the beginning and be like, this, you're just a very introverted person or you're a very anxious person. But you will try your best. And so that is all that we can ask for. We want people who show that effort, that willingness to learn. And so, as I said, do a lot of your own reading at home and bring it up to the attending when you see them, especially if it relates to any of the patient cases that you're seeing over that week, say GI bleed or whatnot. All those are great ideas. And the only way that you're able to overcome anxiety is with more exposure. So I know that it can be difficult, but putting yourself in those uncomfortable situations time and time again, you will get stronger. You are stronger than you think you are. So I know a lot of you who went to med school are like, well, at least for me, I was like, I can't believe I'm doing this. Like every single day, I can't believe I'm doing this. But at the end, like it all works out and you're more capable of doing things than you actually know. So yeah, don't be too nervous. It's going to be a great time. Most attendings are very, very nice. A lot of the residents are very, very nice, especially if you go into FM. We are very, very nice. Oh my gosh. Good luck, Diana, on your MCAT on Friday. You got this. All right. So this is a question I get a lot. How often do I encounter people who undermine or negatively compare DOs and MD providers? So this may sound crazy to you, but the only time I get any sort of negativity or criticism is when on social media, on Instagram, on YouTube, online. In real life, that doesn't happen. Like patients come to me specifically because I'm a DO. Like they seek out, like they're all like, do you do OMT? Do you, if you guys don't know, DOs, our whole philosophy is more, it's very holistic. I want to say that all physicians try to treat the root cause, but that is specifically our philosophy. Like we look at the mind, body, spirit, and we try to treat the root cause of everything. And so I have patients coming to me, they're like, I read your, your bio and you're a DO, and I really want you as my doctor. As compared to other attendings and other specialists, they look at me like it only matters how you treat your patients and how you care for your patients. And so they read through my notes for them, and all of them always have good things to say. and actually refer their patients to me to do their procedures. And so if other providers didn't trust you, then they wouldn't refer their patients to you. So I think it's a very superficial thing and an online thing that people who are not as educated and who are not in the medical field would spew off, you know. But I have never gotten any hate or criticism in real life. So be the best physician, be the best doctor that you can be, and your patients and other providers will respect you for that. So whether that be DO or MD. All right. I know, I wish I can show you guys Summer. Okay. Okay, lots of questions on the MCAT today. What are your thoughts on studying for the MCAT on your own, self-study at home, rather than going to college? I think, I mean, you want to study for the MCAT to get into medical school, right? And I think that you have to have certain prerequisites and graduate with a bachelor's degree as one of the prerequisites to get into med school. So as for studying on your own versus going to a prep course, I think that if you had the funds, then you might have an advantage. But the MCAT itself is a way of testing. It's a horrible way. It's like standardized tests. Just because you do well on a standardized test doesn't mean that you're going to be a good doctor. And who does well on standardized tests is like people with practice who are taught in that way to look at questions in that critical mind, you know, and it's all down to privilege. And so the people who do better have just trained longer and who've had access for this. Just because you take one prep course doesn't mean you're going to do extremely well as compared to someone who's been studying that way their whole entire life. And so I personally did not have a prep course. I just got the books and I read through them and studied from them on my own. As I said earlier, if you're able to get Anki and study from those Anki cards in addition or with whatever other resources that you have, then I would say you can do better. And at the end of the day, it's just practice test questions. You have to do all the practice test questions and go through every single question, not only the wrong ones, but also the right ones. Because sometimes you might think that I got this question right, I don't need to review it, but there are a lot of reasons why that question is right, and it'll tell you in the answer. So yeah, you will continue to get it right the next time. Does that make sense? I hope that makes sense. So yeah. Do your first year grades matter for med school applications? So I want to remind everyone that your grades do not determine how good of a doctor you will be. And we look at a lot of different things when you're applying to med school and residency. So yes, grades are a small portion of that, but there's also the MCAT, there's also extracurricular activities, there's also volunteering, there's also research. And so if you're still a first year, there's plenty of time for you to see a trajectory going up, right? So if you started here and your grades still going up, that shows us as interviewers that you learn from your mistakes, that you reevaluated what you were doing, you found out what didn't work, you were able to change it, and now you're studying better. So that person will probably, we will probably look at more through a different lens like in a better light than someone who just like did this, right? So my first MCAT, I did poorly. And then the second time around, I did really good. Like I scored like 8 more points. I know the MCAT system is totally different now, so I don't even know how to compare, but I did bad and then I did really good. And a lot of my questions during my interview for med school was, what did you change and how did you score so much better the second time around for your MCAT? I was like, well, the first time I had a lot of life events that happened to me. My boyfriend of 3 years had been like cheating on me during that time. And like, I found out a week or so before I took my first MCAT. And so it was really bad. And then I said that, you know, I learned how to study more efficiently. And, you know, I ended up doing better the second time around, obviously. So trajectory of where you are in life and in your grades are much more important than like getting a C or failing here and there. Okay. So don't worry. We look at the application as a whole and not just one aspect of your application. Oh man, studying for step 1 with an 18-month-old toddler. This is so hard. I don't know how you can do it. I did step 2 with 2 young children, but at that time, I feel like step 2 was a lot easier than step 1 because I had just had more clinical knowledge. So I would have an app on my phone. I would use a test bank. The one I used was TrueLearn, I believe. And I would just do questions all day long. Like instead of doing 50 at a time, I would do 5, 10 at a time whenever they were sleeping, or if I was nursing or my toddler was sleeping on me, I would just go through and do test questions. The more, as I said, the more test questions you do, the better you will do on the board exam. So I talked about this a couple of times for the difference between family medicine and internal medicine, FM versus IM. So they're very similar because both can be primary care physicians, but I would look at it as FM, family medicine. You want to see everybody from children at birth all the way into geriatrics and in death. So if you're interested in pediatrics and OB-GYN, then I would say go more towards family medicine. If you're interested more in subspecializing, say in cardiology, gastroenterology, rheumatology, all the different ologies, then I would say go more towards internal medicine. If you're interested more in hospitalist medicine, being an internist, working in the hospital, then I would say go more towards internal medicine. I think family medicine has a little bit more procedures, small procedures on the outpatient side rather than internal medicine, but that's just my experience because my practice is very, very procedure heavy. And in residency, we had an internal medicine and a family medicine program, and all of my FM colleagues had a lot more procedures. And so if you wanted to do fellowship and subspecialize, family medicine tends to go more into like emergency medicine, sports medicine, or like palliative care and things like that. While internal medicine, most of them stay within the hospital, become hospitalists, critical care docs, cardiology, rheumatology, gastroenterology, and things like that. So within the hospital, if you become a hospitalist, you get to do a lot bigger procedures like paracentesis or thoracentesis and like central lines and things like that within the hospital. But outpatient, I get to do skin biopsies and excisional shaves, colposcopies, lots of GYN procedures, knee injections, shoulder injections. So I think you would just have to think, oh, and then internal medicine doesn't see peds at all unless they do a fellowship. And internal medicine doesn't deliver babies at all, but they do still do some gyne. Yeah. So I hope that helps know the difference. But yeah, a lot of my patients are like younger, healthy individuals who want to talk about family planning, or safe sex and things like that. I feel like that's more my patient population as compared to my friends who are in internal medicine. They have a lot more patients who are older with multiple comorbidities like hypertension, diabetes, heart failure, AFib, things like that. Yeah. Both are awesome. I think it just depends on the type of person you are. Okay. I'm going to take a little coffee sip. This is my mug that I got after residency. It says straight out of quarantine, class of 2020. And we are still technically in this. I thought it'd be over by now. All right. Next question. How much chemistry do doctors use daily? Is this a subject that I have a hard time understanding sometimes? I think it's very important that we understand the basics of biology and chemistry. I would say with this whole pandemic and the way that the virus is replicated and the way that things are transmitted, it all has to do a little bit of biology, virology, and all that stuff. And so I would not say that I'm thinking about it every single day, but it plays into the different aspects of medicine. So that's kind of like your basis to understand and go forward. I don't think I'm using like OChem on a regular basis at all, but I know that's one of the requirements to get into medical school. I know that I'm not doing physics at all in medicine, but it was also a requirement to get into med school. So I don't know. I don't know who comes up with these prerequisites. Are you still considering opening your own practice at some point? Would love to hear your thoughts on this. If you guys have not followed me for a long time, I was previously thinking about opening up like a solely OMT like practice. And I'm still very considering it, but I love family medicine. Like I love providing care for everybody. I love the diversity. I love that I can see a child and do a wellness visit. And then another time I can do a colposcopy. And another time I'll be managing someone's depression and anxiety, and then jump over to do diabetes and hypertension management. Like it's just so much of everything. And I feel like I have a little bit of ADHD that it keeps me on my toes. And so I would love to open up my practice like later on in life, because I know that I never want to lose OMT. Like I still want to do it. Like my friends would come over and I would just treat them with OMT sometimes. But I don't want to give up family medicine as of right now. And family medicine is something that you have to continuously practice because medicine is changing so much. There's new guidelines for like asthma and how you should treat this. And so if you're out of practice for too long, then you are going to not remember how to do certain things like manage hypertension and diabetes. And that's why doctors every 10 years have to renew their license and take another board exam to make sure that your knowledge is up to date and you're practicing with the evidence-based standard of care. And so eventually I would possibly want to do that. But as of right now, like I'm happy with still doing family medicine. I think like maybe if I wanted extra money, then I could do that on the side. But it just seems like too much work right now. Like I have Wyatt and London who take up most of my time, and now summer when I am not working. And so it's really hard for me to commit to another thing when I feel like I might be spread too thin. And so maybe when they go back to school, I can do like 1 day a week where I would just see patients for OMT specifically, but then I would never be able to take a break because patients will always want to see me. So yeah, it's a lot to think about, but still considering it, maybe one day, but not anytime soon. Okay. Let's see. How is everybody else doing? Stan and I went on a hike today and we brought Summer with us. If you're in Washington, it's called Poo Poo Trail, like literally POOPOO Trail. And people go paragliding on the top. And once you get to the top, you can see Mount Rainier. So it was really, really nice. But it was like 1,500 elevation or something and a total of 4 miles. Summer did the whole thing, so it was pretty impressive of her. She's probably sleeping right now. Okay. Let me see. Do you guys want me to talk about I also wanted to talk about like what happens during a wellness visit. Is that something that you're interested in? Like, no one's asking questions, so I think I'll talk about that. So a lot of people don't come to doctors, one, because they don't have health insurance, but also two, they wait until they have all these issues and want to go and talk about everything at the same time. And I don't think that that's very beneficial for either the patient or me as a doctor. So as a family medicine physician, I am all about preventative care. I want to talk to you about things that keep you healthy. And so if you're a young, healthy individual, like please come in to see me so at least once so that we can talk about all those things. So what do we talk about specifically during your wellness visit is here, let's see. So what do we talk about during your wellness visit? If you're a female, we talk about, or if you have a uterus, we talk about your menstrual cycles, like when was your last period? How long did it last? How is your flow? Is it heavy? Is it light? Do you get associated cramping with it? Are they cyclic? Which means that do they come every month around the same time? History of sexually transmitted infections. What are you doing for pregnancy prevention? Your identity. Do you identify as female or male? And are you interested in men, women, or both? So those are the things that I asked about that area. I also ask you about your diet habits and your exercising habits. The American Heart Association recommends 150 minutes of cardiovascular exercise in a week to help prevent heart attacks and strokes. I think weightlifting is very good as well. I asked about like other recreational drug use or smoking or excessive alcohol use. I asked you if you feel safe at home physically, financially, mentally. And then we talk about your stooling habits. Is there any black stool? Is there any bloody stool? How often do you go? Do you have constipation or diarrhea? Are you bloated? And then I also asked about breast cancer screening. Are there any breast cancer in the family? And then obviously like your other family medical history. Anyone have early heart attacks or stroke before the age of 50 or 60? What else? And then talk about vaccinations. Do you have any questions about vaccinations? So if I'm doing a very good job and I'm doing a very thorough job during your wellness visit and educating you, that visit in itself sometimes like should take at least 30 minutes. And so if you have other things, and then we also screen you for depression, anxiety. And if you have any of that, we talk about that as well. And so if you have other questions that you're like, I'm going to do the wellness, but I also want to talk about this other thing and this other thing and this other thing, it's really difficult to provide patients with good care, especially if you need to do that education. So if possible, please only come to your doctor with 1 or 2 issues and then do a wellness visit separately. I hope that helps. All right. Now, lots of questions. Let's see. Have you ever considered doing locum's job? I have, because when I was doing inpatient medicine, I really enjoyed it. Working as an internist or a hospitalist. And so my attending told me that I was really good and that I should consider doing locums just once in a while. But the thing with locums is that you don't really get to pick where to go. And then sometimes I would have to travel really far. And I didn't want to leave my 2 very small young children, even though it was just like a few days at a time. Like, I didn't know if I can do that. And so, yes, I considered it. But as of right now, like, I don't think that I would take on more work, especially given the state of the pandemic right now. My children are very young, 2 and 4. And so I would hate to get sick and then expose them. Like, that just scares me, especially with all the higher cases of children being hospitalized right now. Like, I would not be able to live with myself. And I just hate driving. I hate driving. I wish I could teleport. That'd be so awesome. Yes. So medical training in itself, medical training, residency, fellowship, it is all very time consuming. I think that you should still live your life. Like, I had Wyatt during my 4th year, before I graduated, and then London during my 2nd year of residency. But I would say that, my schedule didn't change. I still worked 60 to 80 hours a week. It consumed a lot of my life, and that's why now I'm choosing to work part-time. There's always options to extend your residency. I know it sounds really difficult because you're going against the grain and everyone expects you to work like nonstop for the rest of your life, but that's not how life is, right? And until more of us decide that we should take more times for ourselves and that we should just extend residency for our own mental health, then it's not going to pave the way for others who want to take that same path. Right. So the more that you step into your own and the more that you do go through training how you want to, the easier it will be for those following you to continue in those footsteps. But I'm going to say that medical training is going to be hard no matter what subspecialty you go into. And so I don't know if it's going to change or not, but before it used to be like, oh, residents have to work. There's no cap on how many patients you see. There's no cap on how many hours you spend. I remember talking to surgeons and they're all, yeah, we worked over 100 hours a week and we were on call for like 3 days straight. And for me, they finally set in like limitations. So you're not supposed to work over 80 hours a week, even though some residents still work over 80 hours and they just don't record it. And then you're not supposed to work right after a 24-hour call. Like, you're supposed to have at least like a 4 to 8 hour break in between 24-hour calls, unless it's like OB-GYN, and that's different, that you can do longer than 36-hour call or something like that. But there are restrictions now just for your own safety and patient safety. But I don't know there's a way to get around that. I would also say that you should be open to, like, the best medical students that I have found are the ones who are like I know I want to be in emergency medicine. Like that's who I want to be, an emergency medicine physician. But I'm also going to learn from every other subspecialty because that's how I improve myself as a doctor. And who knows, like you may think that you want to do emergency medicine, but end up loving something else like OB-GYN or dermatology or something like that. So I'm just saying, be open to the training and be open to all the other subspecialties. Okay. Mm. Oh, this is so hard. This happens all the time, and there are people that can help with this. So the question says, can you speak on how to properly answer ethic questions during med school interviews, like a patient can't afford an MRI? What do you do? So you refer them to like social services, or there's always programs that the hospital can do to help provide them the care. In the meantime, we need to discuss what are our other options, how we can best help this patient in the meantime until they have their MRI. Because this is what happens in real life, right? Patients say that, or doctors say, hey, we think you need an MRI. And then an insurance company says, no, we're not going to cover this MRI. You need an X-ray, you need physical therapy, you need to go see the specialist, you need to do all these things before you can get the MRI. So I'm saying, like, still do the best patient care that you can, but refer them to somebody who can help them, like a social worker. Okay, I get this a lot, and it really depends on what kind of community that you're in, right? And I think a lot of hesitancy comes from the fact that there's not a lot of information and not a lot of education for vaccines in general. Like, people are worried about the long-term side effects of a vaccine. And that is totally understandable because before this, vaccines have not come out for a long, like taken years to come out, right? But if you don't understand like the bureaucracy behind developing vaccines and getting them tested and the funding and all that stuff, then you may think that, oh, it came out very fast. But really, the development of the vaccine can literally take months. And then the testing part and recruiting part and getting enough patients to be willing to take the vaccine or just getting approval is what actually takes longer. As compared to the long-term side effects of vaccines, I compare it to, people don't understand that the majority of the most dangerous adverse reactions happens within the first 1 to 3 days, which is anaphylaxis, right? And then even the most rare, like Guillain-Barré's, happens up to 3 months. After that, we know based on biology that you don't get reactions anymore because that's just not how it works. It's kind of like saying, hey, I got drunk on Friday and I'm hungover. That's like the side effect from drinking too much, right? But you're not going to be worried about the drink you had last Saturday a month from now because the alcohol has cleared from your system, right? It's the same thing with the vaccine. The vaccine stays within your system very, very limited amount of time. I said as a week at the most, but the benefits of your immune system learning and developing antibodies last you much, 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 much longer. And I think that's what people don't understand. And there's so much misinformation out there that it is hard to convince people, especially when misinformation gets more clicks, gets more advertisement, makes more money. No one's incentivized to take down misinformation. And that is what's frustrating for me when patients come in and they're just so scared. And so we spend a lot of time talking about those fears and addressing all that misinformation. But it's hard when you're hearing it all the time. And so I would say approach hesitancy with kindness, because most people just want to protect themselves and their families. And right now, I would say the vaccine is the best way to protect yourself and your family. The one thing, though, I don't like about the United States is, like, yes, it's amazing that my family came here and it's the land of opportunity and you can be whatever you want to be, but it's very non-altruistic, as in, like, you only look out for number one, which is yourself. And I have seen too much, and I'm trying to convince too many people to care about their fellow neighbors that it is frustrating. Like, yeah, I'm just like, why don't you care? Like, yeah. It's like when people say it's only affecting people with comorbidities. And I was like, yes, but my dad has comorbidities. And you're saying that you don't care because they're not young and healthy. So that's what's frustrating for me. All right, rant over. John Ross, he wants to be an OB-GYN. He knows from the get-go. So you're gonna, if you have questions, ask him. Okay, this question. I haven't taken an MCAT, but currently in my second gap year and wondering if I should put more focus on getting a good score on the exam, or I should focus more on getting more clinical experience for a strong med school application. I would say that it's good to have a combination of both. So if you're only going to volunteer for one time, we will be able to see through that on your med school application. So if you volunteer, say if you go for once a week for 4 years or for 3 years or for 2 years, it looks significantly better than doing one trip to, like, Honduras on a mission trip, right? It shows your dedication to medicine and it shows your longevity over time. Because honestly, we'll be able to see through a lot of the fluff that people try to put into their med school application. And so that, and then with the MCAT, I think you can study and still volunteer 1 day a week or expose yourself to clinical rotations once a week. If you are able to publish, though, I would say being published probably would make up for a not so great MCAT score, because not everybody, but I'm saying, like, all the institutions love it when you're published. So if you can do that, I would say focus on that, but still get, like, a decent MCAT score. Just my 2 cents. Someone else might disagree. All right. So I'm going to end this soon. Any last questions? But I love hanging out with you guys today. Oh my gosh, so many good questions. I will always save this again on my YouTube, and then you can reference it later on. But yeah, we are not going to have this next week, I don't think. But it just depends. Like, put on your notification bell and I'll let you know if we're going to do this again. We were supposed to have a video on Sunday, but we were supposed to have a video yesterday, but my thing broke. And so I couldn't upload any of my footage onto my computer to edit. But it's all about, like, the science behind weight loss. And I've actually been able to lose weight now as compared to my plateau earlier. So it's just an update on that. If you guys don't follow me on Instagram, I've been doing like a lot of polls, so you can comment on what kind of videos you want to see. Always open to suggestions. Okay. And then let's see. This is funny. Any good medical books you recommend reading for fun? I don't know if I read any medical books for fun. Like I have a subscription to a family medicine journal. If you don't, I recommend like the New England Journal of Medicine. That is a really good journal to subscribe to. And then you can be up to date on all the new things that are coming out. So if you want to do that sort of reading for fun. A good one that all my friends have read is by a neurosurgeon. It's called When Breath Becomes Air. And he personally wrote it. It's like an autobiography-ish. Really, really good book. As I said, by a neurosurgeon, and how he went through residency and got cancer and stuff like that. So check that one out. And yeah, so that's all we have for today, I think. Okay. Thank you guys all for coming. I'll see you guys again soon. If not, I will see you on Sunday. Yeah. Cheers. Peace.